Hi, it's Dr. Lauren here. We're going to talk about mental health, massively important topic. Just a little bit specifically about what is mental health or mental ill health, and some statistics that demonstrate really how common it actually is. So the World Health Organization defines health as a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. So it's a positive statement. It's not just the absence of not being ill, it is being positively well. Furthermore, they define mental health as a state of well-being in which every individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and also able to make a contribution to his or her community. Now, there's various other definitions of mental health, and they are either kind of focused on positive psychological well-being, but also the absence of mental health issues, and obviously a focus around kind of emotional resilience as well. So there's quite a lot of terms to describe mental ill health. These might be mental health issues, mental health problems, mental health difficulties, mental illness, mental distress, extreme emotional distress, mental breakdown, and obviously, these can mean different things to different people, and they don't actually give a lot of information about what the person themselves is actually experiencing. So there's different types of mental illness, some of which are very common, like depression and anxiety disorders, some less common, like schizophrenia and bipolar disorders. And then if we consider the term mental health issue, this is more of a broader term and includes both mental illness but also symptoms of mental illness that may not be severe enough that warrant a diagnosis of mental illness. So how common are mental illnesses? Well, extremely common. So the World Health Organization statistics show that 676 million people are affected by mental health issues worldwide. Now, worldwide, 50% of people will have the first onset of symptoms in their mid-teens and 75% by their mid-20s. And depression is the number one cause of disability worldwide. In the UK, 1 in 4 adults are diagnosed with a mental illness in their lifetime. 1 in 5, in addition to this, will experience a mental health issue without a diagnosis. And in any given year, 1 in 4 people will experience some form of mental health issue. The most common in the UK or in England is depression, followed by panic attacks, followed by general anxiety disorder. In 2014, the estimated cost to the economy was 70 to 100 billion pounds per year, which is basically pretty much the entire budget of the NHS. Now, importantly, 75% of people with a diagnosed mental health condition receive no treatment at all. Another important statistic is that suicide is the most common cause of death in men aged 20 to 49. There's a close connection between mental and physical health. There was a study that showed the cost to the NHS of about 11 billion per year by trying to treat physical and mental health issues when they would separately, when they'd be more effectively treated together. And equally, those who have a long-term physical problem, 30% of them also have a mental health problem. And for people with a mental health problem, 46% of them have a long-term physical problem. There's also obviously an issue to the wider economy via the workforce. So 91 million working days are lost in the UK due to mental health issues. There is a massive amount of stigma attached to mental health, and that will be something that's referred to quite often. I'll refer to when I do separate mental health videos. But there was a study that showed 40% of people think that those with a mental health issue are prone to violence. That was actually several years ago, and that number is now increasing. actually you're twice as likely to be struck by lightning than you are to be murdered by a stranger who's got a mental health problem. And in fact, people with severe mental illness are much more likely to be the victims of violence than the perpetrators, and are much more a danger to themselves than to others. So it's really, really important to tackle this kind of stigma.